Today I am going to discuss about the surgery clinical history taking and what are the important points with respect to chronic cholecystitis and cholelithiasis. Now let us give a overview what we are going to discuss. First, what is cholecystitis, what is cholelithiasis, and what is cholelithiasis. Whenever there is inflammation of the gallbladder, it is known as cholecystitis. Now, cholelithiasis is the formation of gallstone. We will later discuss what are the types of gallstone, what are their compositions, and how they are formed. And what is cholelithiasis? Whenever the stone comes to the bile duct, that is common bile duct, etc., it is known as cholelithiasis. Now it can lead to cholecystitis, that is inflammation of the common bile duct. It is mainly associated with painful palpable gallbladder. Otherwise, if the stone is present inside the gallbladder, it won't cause pain. It may cause jaundice only. Now, next we will discuss the biliary tree anatomy. What is the blood supply of gallbladder? Types of stones and their composition and formation. Now, complaints. Patient mainly comes with complaint of pain in case of acute cholecystitis, and pain also can be present in case of chronic cholecystitis. Then it is episodic in nature. Next, jaundice, nausea, vomiting. We will elaborate each how to take history. Next is clinical examination, how to elicit to a particular differential diagnosis. Now in this image you can see that right and left hepatic duct are coming from the right and left lobe of the liver respectively. It is joining the cystic duct coming from the gallbladder. Now common bile duct is formed. Ultimately it is mixing with the main pancreatic duct, that is the duct of Wirsung, and ultimately draining the bile into the ampulla of water present in the second part of the duodenum. What are the parts of gallbladder? It has mainly three parts: fundus, body, and neck. Next, discuss the what are the parts of CVD. It can be asked in the viva. One is supraduodenal, the part which is present above the duodenum. One part is present behind the duodenum. This is known as retroduodenal. One is infraduodenal. This part is present below the duodenum, and one part is intraduodenal, that is present inside the mucosa of the duodenum before ultimately joining into the lumen. Next, in this image I am showing you some sphincters which are important. Sphincter of Boyden, it is present in the common bile duct before joining the main pancreatic duct, and sphincter of Oddi, it is present before the draining of the common hepatopancreatic duct into the ampulla of water. Next, what is the blood supply of gallbladder? In one word, it is cystic artery. Now, cystic artery is branch of the right hepatic artery. Right hepatic artery is branch of hepatic artery proper. Hepatic artery proper is branch of common hepatic artery. It is originated from the celiac trunk, which is the branch of abdominal aorta. Now, what are the three branches of the celiac trunk? These are common hepatic artery, left gastric artery, and splenic artery. Next, as we have promised, we are going to discuss different types of gallstones. One is cholesterol stone and one is pigment stone. And pigment stone is again of two types. One is black pigment and one is brown pigment. Now, cholesterol stone is found in most of the cases, and it is composed of cholesterol. If it is composed of calcium bilirubinate, it is black in color. If fat is also present, the black color, you can remember like this, black color is faded due to fat, which is yellowish color, then the brown pigment is formed. It is mainly associated with infection of parasites. Now come to the history taking. In case of history taking, as the main complaint is pain, we have to elaborate the pain under the Socrates point. What is that? S for sight, O for onset, C for character, R for radiation, E for exacerbating factor, T for special time of occurrence, E for alleviating factor, and S for severity. I remember like this. It is little bit altered, but I remember like this. Now, what is the onset? In case of acute cholecystitis, it is sudden in onset and rapidly progressing. But in case of chronic cholecystitis, recurrent episodes are present, and it may or may not be. That history you have to take from the patient. You have to ask, if it is insidious in onset, then it is gradually progressing. But the site of pain is very common in both of the cases, that is right upper quadrant. The pain is mainly associated with fatty food and alcohol. It may be dull achy but more aching in nature, but mostly colicky pain is present because whenever the stones is broken down into small pieces and comes to the gallbladder, it causes stricture and pain. Aggravating and relieving factor. Aggravating factor we have already discussed. Fatty food, heavy meals, alcohol aggravates the pain in cholecystitis. And in case of relieving factor, we may say vomiting or fasting relieves the pain, as it is written here. Next come to what are the nature of pain. In case of chronic cholecystitis, the pain is intermittent in nature and presents with nausea, dyspepsia and bloating. Flatulence may patient give history of flatulence and more frequent or intense over time. Now let us elaborate the associated symptoms like nausea or vomiting. What is the amount of vomiting? It may be small amount or it may be large amount. What is the color? Now color indicates the contents. Like if patient says that the vomitus is red in color, it means blood is present in that. If it is yellowish in color, then it is recent food. If it is just water like, then some secretions may have come out. Next is contents. You have to ask the patient whether it contains the recent food particle she or he has consumed or not, or it is bile. If bile is present, it may be greenish in color. Next, what is the taste of the mouth, like whether it is bitter in taste after vomiting takes place. Next, association with food or not, whether after taking food vomiting starts. Now jaundice. How to elaborate jaundice? First is onset. In most of the cases actually jaundice is insidious in onset and gradually progressing, and gradually it intensifies over time. Next is progression. It is naturally progressing over the time slowly. And what is the duration and whether patient has detected by himself or by doctor, whether it is associated with pale stool and dark urine or not, whether fever and weight loss is associated or not. Fever indicates towards the inflammation, and weight loss may indicate towards the malignancy. It may also be associated with chronic malnutrition. So, in case of acute cholecystitis, weight loss history won't be present, but in case of chronic cholecystitis or malignant cases, it may be present. Now, some important points associated with examination. First is general examination. Examination includes inspection, palpation. Now here auscultation may be done for the vowel sounds, and otherwise it is not required. In case of inspection, first we have to inspect the general abdomen. What is the shape of the abdomen? Like normally it is scaphoid in shape. What is the position of the umbilicus? Whether any venous engorgement or prominence is present or not, visible peristalsis, etc. Next we have to come to specific point, like whether any lump is present, visible or not, etc. In case of palpation, one more point, whether the abdomen is moving symmetrically with respiration or not, all this comes in inspection. In palpation, we have to palpate all the 9 regions of the abdomen. What are the 9 regions? Left hypochondrium, right hypochondrium, epigastrium, right lumbar, left lumbar, umbilical, right iliac, left iliac, and hypogastrium. We have to palpate all the quadrant. If patient complains of pain, we have to start the palpation from the distal most quadrant as much as possible. Next we have to check for Murphy's sign if we suspect any pathology of the gallbladder. What is Murphy's sign? In Murphy's sign, patient is asked to inspire, then we have to make a deep palpation, and then observe the patient's breathing. If the patient breathes, holds their breath, then it indicates acute tenderness is present. This is known as Murphy's sign positive. Next is palpable gallbladder. Palpable gallbladder may be present or may not be present. Palpable gallbladder, if it is painful palpable gallbladder, it may be associated with stricture or choledochitis. If it is painless palpable gallbladder, it may be due to malignant cause like periampullary carcinoma, etc. Now, what investigations are done? First is blood test. Check for the amylase, lipase, which are mainly associated with the metabolism of the fat. Whether CRP or ESR is raised or not, it indicates inflammation. WBC count also indicative of the inflammation. Next is imaging. Abdominal ultrasound is the first line choice of investigations to detect the location of the gallstone and obstruction. It also identify the shrunken fibrotic gallbladder. Next, HIDA scan, that is hepatobiliary immunodiacetic acid. It is a cholecystography can be done, or MRCP can be done, that is magnetic resonance cholangiography. Next is treatment. What is definitive treatment in case of chronic cholecystitis? It is elective laparoscopic cholecystectomy. It is very much common and it is much more less invasive as compared to open cholecystectomy. Now, medical therapy, diet modification, low fat diet, pain control, NSAIDs, sodium acid, etc. Now, in Viva table, we are asked to 5 signs which are the risk factor for gallstone: fat, female, fertile, 40, and fair. They are more prone to gallbladder. If the patient belongs to this category, we can suspect that patient suffer from disease of gallstone. Now here we have added what are the causes of painless palpable gallbladder. We have already discussed that this sign is known as Courvoisier sign. Main causes is periampullary carcinoma, cholangiocarcinoma, pancreatic head carcinoma, and metastatic lymph node causing obstruction. Here you can see most of the malignant causes. What are the causes of painful palpable gallbladder? It is stricture and choledochitis or choledocholithiasis. Here we have completed our discussion. Thank you for your patience.